Okay, so tell us your name.
Michelle Rowton.
And tell us what kind of a nurse you are. Do you full medical trained nurse?
I am a neonatal nurse practitioner. So I am a nurse practitioner that specializes in 2 and under, the ages 2 and under. I have, 17 years of experience in the NICU, neonatal intensive care unit, premature sick babies, and I have been working as a functional medicine nurse practitioner out in the field for, 6 or 7 years now.
When you were training to be a nurse, you know what I'm going to say, don't you? When you were training to be a nurse, tell us the kind of training and all the information you got on vaccines.
So as a nurse, when I was getting my bachelor's degree, we learned how to give the injections, and that was it.
Were you told that they were important or anything like that?
They're important. The doctor is going to write the order, and you're going to give them, and you're going to check the name and the date of birth, and that you have the right vaccine and the lot number written down and all those sorts of things, and you're going to give the injection and mark what site you gave. That was pretty much it.
Anything about any side effects or anything go wrong?
Mm-mm.
So you just assumed they were safe?
Mm-hmm. When I was in graduate school, so that was for my master's degree, my neonatal nurse practitioner degree, they said, hey, learn the schedule, and they taught us coercive rhetoric to get the parents to agree to have their children vaccinated.
And what sort of thing would they teach you on that? How would it go?
I remember there was, literally it was a tiny section. So basically it was just, your babies need it. There shouldn't be a question. This is what we do. They're safe and effective.
Did they tell you how to deal with people that were questioning it, or anti-vaxxers as they like to call us?
They didn't really. I really think there were 4 to 6 questions about it that at that point, I already was well aware what was going on. And I remember talking to my husband about it and kind of going, this is so ridiculous, but answering the questions and moving on. I really didn't see the hard push for how to deal with the anti-vax community until about, 7 or 8 years ago. I would get free pediatric physician publications that would land on my desk, and they would go through specific strategies on how to get people to sign, or, it's not a question. We are going to go ahead and do these today. There's just really not a lot of information given.
We're getting a lot of doctors that are saying to parents now, well, I've just given it to my child. And it seems to me that it can't be a coincidence that all of these doctors or nurses are suddenly saying, well, my child just had that vaccine, my child had Gardasil, my child whatever, and they're absolutely fine. So they must have had a memo going out.
There's always a memo. They're always changing the strategy about what to say about this and what to say about that, and we haven't had any issues in our practice. Reassure them that everything is safe, that you have not personally seen any issues in your children or in your clients or your patients, anything like that.
So you go, you train, you start working. Do you actually administer the vaccines yourself?
I do not.
Never have done.
When I was in the NICU as a young nurse, I got to the point where I was charge nurse or doing transport in helicopters or ambulances, so I wasn't really involved in that. Probably as a young nurse, I gave a hepatitis B vaccine a few times. I did get to the point where I would just shove it off to the next shift because I didn't want to do it. I did have a patient once that had a hepatitis B vaccine in a referring hospital and then was having some issues. They called for a transport to bring into Dallas to a tertiary care center, and they did not pay attention that the baby had already had the vaccine, and so the baby got the hepatitis B vaccine again, which of course, the hospital took very seriously, and it was written up and what's the process problem and all of that kind of stuff. But I was sitting in the room because people were at lunch in the middle of the night, and the monitors talk to each other in each little pod, and I look up and I think, that's strange. Well, that's really strange. And so I jump up, and that baby is having a seizure on his side and frothing at the mouth and all that kind of stuff. So I run over and intervene and kind of resuscitate and pull the code blue button, and we get him up on a warmer because he was supposed to go home in the next couple of days. And I remember the neonatologist, we had to wake him up. Hey, this happened. And he's like, gosh, this is so strange. Why would this happen? And I said, well, this was the baby that accidentally had the 2 hepatitis B vaccines. And he was like, well, why would that do it? And I'm just looking at him like, are you being serious right now? That's a lot of aluminum, dude. And this was years ago. This is why I was a bedside nurse. And so to me, it was always like A plus B equals C, or 1 plus 1 like, this happened and now this happened. Why is this hard to imagine? But I think the cognitive dissonance is very high. You would have, you have a NICU, like a level 3, and then you would have the step down unit where they were the more convalescent babies, and they would call, you would have a neonatologist call level 3 and say, hey, do you guys have any beds open for this weekend? Because we have 3 or 4 babies that are due for their 2-month shots. Mind you, they're not even supposed to be born yet, but they're 2 months old, and so we're going to do their 2-month shots on time. And I just need to know that you have beds open so that when they start having issues, you guys can readmit them to the ICU from the special care nursery. They call and they ask. And if we're like, dude, we're full at the brim, say I'm the charge nurse, I don't have any beds and I have triplets waiting that are going to deliver, or whatever it is, they go, okay, we'll wait till next week. And they would wait.
So they know.
They know, but they don't.
So your time with these babies, and you're specialised in 2 years and under.
Mm-hmm.
What else did you see that you were clear in your mind was vaccine injury? So talk to us about what you've seen.
So in the NICU, what I would see would be beating intolerance, apnea and bradycardia, which is forgetting to breathe, and then the heart rate dropping, increasing respiratory support, like having to go back on the ventilator again.
And these are all vaccinated babies?
Mm-hmm. I mean, within the next day or two. Some kids would code, like we would have to do chest compressions and everything else. And they just, I don't know, they write it off. I remember it's very strange in the NICU to have a baby to be there for a year. That's not a thing that happens a lot, but you have these micro preemies who are really sick, and sometimes you get kids that are there for a long time. And I remember we just happened to have 3 babies that made it to a year. And so they were getting their year shots in the NICU. Mind you, they have not been well enough to ever leave the hospital since birth. And this neonatologist walks up to me. Of course, you can imagine why it's me, because I'm just a little bit vocal. And he said, have you noticed that these babies that had their MMR in the unit, like, none of them want to eat? Like, none of them will PO feed anymore? And I said, yeah, I've noticed. What do you expect? They're like 8 pounds or 12 pounds or whatever they were. You just gave them all of their shots. And
so you mean, when you say MMR, you mean a year onwards?
And they were this is a thing that happened years ago, and they moved them to a different part of the unit to give them a live virus vaccine, which they don't even want people visiting when they got it. It was very strange to me. So, or even that they got their 2-month shots or their 4-month shots or whatever, 6-month shots, all of those things that were going on. And I would have maybe a doctor say something here, a nurse say something here, but nobody ever really blew the whistle, so to speak. It was just kind of murmurings. And I think probably I was getting those conversations because they knew that I was open to the conversation and paying attention and pointing out, going, well, you gave him his shots and now he's intubated and he's never been on a vent in his entire life. He's been here for 2 months as a tiny baby. And some of them will laugh and go, I know, isn't that embarrassing? They just really don't get it.
So what we hear from, mainly on the internet, but what we do hear from parents as well, is that when they go to their doctor or in a hospital situation and they don't want to vaccinate, so whatever they're there for, they just say, look, we've already vaccinated, it's not good. They come back, nurses, just like you, they come back and they say, if you'd seen all the deaths that we'd seen from diphtheria, from measles, from you name it, if you'd seen what we'd seen with these deaths in a hospital, thousands they claim to have seen, then you'd realise, well, we're pushing these vaccines. Tell me how many deaths you've seen from unvaccinated babies under 2 from any of these conditions.
0. They're lying, especially when they bring up chickenpox. I'm like, what nation were you in when that happened? Because it did not happen here. They're lying. You know, I moved out of the hospital into the clinic because I got to the point where I thought, this is the same thing over and over again. Yeah, I'm really good at putting in central lines and putting in chest tubes and saving these critical babies. When they get to the convalescent stage, it's terrible what we're doing. And if everybody's doing the same thing, I can have more effect out in the community and having these babies from birth until 2, no antibiotics, no ear infections, no medications, setting them up for life to have a far less chance of autoimmune disease, chronic disease, all of that kind of stuff. That's what I want to do now. And so when I'm looking at those babies that are born term and they come out into the community and the parents don't want to vaccinate, or I have kids that are delayed on a delayed schedule or stopped vaccinating, I see ear infections, eczema, ton of eczema. And I heard you talking about the vitamin K. I mean, we really have made a link between vitamin K and eczema. When you have even unvaccinated babies, they're having vitamin K shots, and the thighs correlate energetically to the stomach. And so sometimes I'm even getting relief in eczema babies just by doing a Mediclay, like mudding the thighs of the injection areas and really getting all of those tissues healthy again. You'll get a clearing of the skin a lot of times. Psoriasis you're seeing,
Allergies,
tons of allergies, motor delay, verbal delay, all of that kind of stuff.
Just one other question, you may not be able to answer this, but it's been really bothering me and the peeps. So when we interview parents whose babies have died or stopped breathing and got rushed to hospital, when they get to the hospital, the ER department, they say, this is what's happened, they've just been vaccinated. And the doctors will then say, it's nothing to do with the vaccines, but we're going to send your baby off for a ton, because, if the baby is still breathing, we've had stories where they've got them back breathing again, of what I think are ghastly, invasive, God knows what is going on with these babies, and then the babies die, which of course was said, according to them. I have a problem with that. I have a problem with it's not the vaccines, so we're not going to investigate, but we are going to go and lumbar puncture and chuck a load of medication in, which in my mind is killing the baby, and I can say that because it's me. So do you have anything to say on that?
Cognitive dissonance, I don't know. I have a nurse that I worked with years ago who was very pro-vax, and she listened to what I say when I talk about what I post, my interviews, and she is a pediatric transport nurse for a children's hospital, and she came to me after I gave a talk this year, and she said, I have started every child that I fly out to pick up when something catastrophic is happening. I asked him, when are your last vaccines? And she said, when you start asking that question, you realize it's happening all around me all of the time, and nobody is even paying attention. And so when she reports off to the physician, she'll go through and they had a vaccine 4 days ago. They had a vaccine 6 hours before this started. They had one 2 weeks ago. They had one 3 days ago, 3 hours ago. And she said they don't even make a notion that they've even heard what she said.
So why are you sitting here telling us? Because that's a brave thing to do. Are you still working as a nurse? What makes you sit here? I presume you've just seen the film, and thank you, by the way, everybody's thanking you, saying a lot of love here. Why are you telling us about it?
I think that I've been seeing this for a long time, and it just so happened that I'll tell you my history and what that led me to do. That I had an interview with David Knight on the Alex Jones show, saying, this is what I see in the NICU when they're vaccinated. And it just so happened that a month later, a article in JAMA, came out saying exactly what I just said. Their results were the same. They have increased respiratory support. There were death, respiratory distress, feeding intolerance, all of those kinds of things. And all they got from this study was giving single vaccines and combo vaccines aren't any difference. We can keep what we're doing. That's what they came from, all this data that they had. So I went back on the Alex Jones show to talk about the show because it was just, I don't know, timing, God's timing or whatever. And so I was harassed by a company that I still had privileges with while pregnant.
What does that mean? So privileges with
So I still had privileges to see babies in the NICU even though I was in the clinic. And I had the boss's boss contacted me, the medical director, everybody, and they were harassing me while I was very pregnant. And they were going to fly someone in to talk to me because they wanted to know what my concerns were. And I knew they were just a wolf in sheep's clothing. Anyways, we didn't end up meeting because I ended up going on bed rest. And so I said, I'm sorry, I cannot meet you because I am now on bed rest for hopefully the next 9 weeks until I deliver. I delivered 6 weeks later. And so at that point, they just refused to give me any shifts after I had delivered and then fired me for not giving them any services. And so that's what people are up against. And that's what your providers are up against. That if you speak out, they're going to come after you. And I don't care. You watch that you watch that movie, go watch that movie. And that's what we are seeing every single day. And in the movie, they're talking about, like, we didn't know. We thought we were going to get MMR in this. We didn't realize it was going to be so fast. Well, I get out into the clinic, and I have these perfectly healthy babies, and the parents want to do the best, and they just want to do one at a time. And I get a 2-month-old with a DTaP that comes back 2 weeks later, head to toe with fulminant eczema, and you go, this is bigger than I thought, right? I've been through that, too. Like, the schedule's dense. Like, maybe it's not that bad. It is that bad. One of them is bad. That's why I'm here, because you guys, like, you have to realize that's how bad it is. And then I had a thing this summer with my board, someone that I had testified against in court for child abuse turned me into the board for retaliation. And the board would not even deal with me or look into anything and drug me all the way down to the Capitol. And when I got in there, they started harassing me for being alternative. I had my Facebook page down, I had everything down, but they went to the company website, they found the interviews that they could, obviously, and they harassed me for that. And so no matter what I said, they were going to ding me for it. And so what you guys don't realize is that's how corrupt the entire thing is. And what was it, what's his name, Nicholas Hood, in the movie when he said, I am not a chicken shit. I was like, thank you very much, because there need to be a whole lot more of us out there that are not chicken shits.
They're coming.
Yeah.
Wow, I had about 5 questions. I got completely. Nicola Hood is chicken shit is hashtagging as is trending. Yeah. So your babies. So how many babies have you got? Just got to ask this question.
My husband and I together have 3.
And I'm presuming these babies are born after you knew.
Well,
have you got your own vax study in your home?
Yeah.
Okay.
Nick is going to be 21 next month. He's never been on antibiotics. That's my husband's son. I got him when he was about 9. My husband's always had custody of him. And then we have a 4-year-old and a 21-month-old who have never had anything. No antibiotics, no vitamin K, no vaccines.
And what's the conclusion of your in-house vax study?
Well, hey, we've had the chicken pox about a year ago. It was great. I got shingles literally in the shape of a smiley face right back here. I kept it covered because Jason wasn't yet a year. And when the scab stage showed up, I had these teeny tiny little dots here, and they were both breastfeeding. And I went, well, there went the neighborhood. So one got it first. We went on a 3-hour adventure walk to the creek and played in the water and back while she's popping up new spots.
You unvaccinated disease children out in the community.
Took it right down the country walk, right?
Just how it used to be in my day.
And then 3 weeks later, the baby got it, and he was fine. There was one night that he itched a little bit, and about the time I woke up enough to get the homeopathy, it stopped, and that was it. But we got that out of the way. But I mean, my 4-year-old, she had 25 words at 10 months. 25 words at 10 months. So by 16 months, she was full sentences. 17 months, she was potty trained. She's like a tank now. If somebody gets something in the house, she's like, I'm sick, and then she's done, literally. It's true. And then the 21-month-old, he is a crazy person, yet can be very calm when he needs to be. He will sit and color and do the letter things, and he is very musically inclined. He plays the drums and the piano, and he sings, and they're amazing.
What is your, which I'm really happy for you, what is, I mean, you learn a hard lesson through going through it yourself.
Mm-hmm.
What is your advice other than do your research, which I used to say, but now I don't accept that, because if you do your research, you go on Google and it's all, you just can't get there.
Yeah.
What would you say to the young mum watching right now who's absolutely confused by everything? Honestly, so usually people are asking me for resources. People call me Michellepedia, so I get contact, Facebook messages. You're probably the same way, like a million a day asking. What does that mean, Michelle?
Michelle, like encyclopedia.
Oh, I got it, yeah.
Like what, just tell me what to watch. So I said, well, it depends on where they are, right? If they have a 1-month-old, you only have so much time. Actually, usually send them to Sherry Tenpenny's video, Vaxxines, the risks, the benefits, and the choices, because I feel like for 3 hours, you get a lot of data about the disease and like the history, the etiology, all of that kind of stuff, the vaccine, all the data in one spot for each disease as she goes through it. And then if you have the time, I really like the Truth About Vaccines mini-series. I just don't understand how you can get all the way through that series and decide that that's still a good idea.
So, as a nurse that was trained completely through the medical system, you're now holistic. Mm-hmm. Are you afraid of your children catching measles? We've done chickenpox, mumps, any of the things that we vaccinate for. Are you afraid of any of that?
No. My husband had measles at 45. God love him.
Ooh, how was that? We won't put him on camera, but how was that?
It was a crappy week, but...
Well, I'll tell you what, he's right. He's alive as anything, sitting to my left, and I would take that over my son being brain damaged with the MMR.
And Nick didn't even get it. The 21-year-old, they're like drinking out of the same glass. I'm like, there it goes in the neighborhood. He didn't even get it. But at the end, my husband was like, okay, that was not fun. Could I have been 3 and done that? But is this really what we're freaking out about? That's what he said.
Did your eyes hurt? Were you sensitive to light?
It hurt everywhere.
And your head hurt?
Yeah.
Yeah. We've just gone through a member of our family with this. But anyway, so let's just summarize this up.
I want to say something about the diseases. Last fall, I got the shingles, probably just because sleep deprivation, right? And Julia came down with the chicken pox. Jason had a fever. I'm like, oh, they both have it. No. Jason had roseola. Julia had the chicken pox. Then Jason got the chicken pox. And then a couple of months later, Jason got fifth disease. And I said, you guys don't care about roseola. You don't care about fifth disease, the slap cheek disease, because there's no vaccine for it. And you don't care about hand, foot, and mouth because there's no vaccine for it. Hand, foot, and mouth sucks way worse than chickenpox, let me tell you. Way worse. You guys only care because chickenpox is a vaccine preventable disease, and so is measles. It's the only reason you care. I was like, I was tired, don't get me wrong, because babies don't sleep when they don't feel good. But he did great, and I was like, check. Well, just good. I'm not working right now. I need to go back to work next year, so get all this stuff out of the way.
What would you say to the doctor listening right now that says it's all very well for you, but there's no way I'm jeopardizing my paycheck to stop vaccinating? Don't care.
Well, I like to like myself when I brush my teeth and I look in the mirror in the morning. But I don't see how you could watch Vax 2 and say that. I mean, we're destroying an entire generation of children And if everybody stood up, it's kind of like Nurses Against Mandatory Vaccines that we finally just shut down because nobody had the balls to actually stand up and do anything. If everybody had stood up and said, we're not going to stand for mandatory flu shots in the hospital, the whole thing would have gone away because they would have had no staff to run the hospital. And if all of the doctors stood up and said, I've been uncomfortable for this for a long while and I'm not going to stand for this anymore, it would all be over. So everybody sitting around and doing nothing and collecting their paychecks, they are all complicit in the mass annihilation of an entire generation of children.
So if any nurses listening now want to join you, is it completely shut down, or is there somebody? That's sad.
I was not the CEO of that, so that's what she decided to do. But it is sad. But I think more and more every flu season I get more and more contact from nurses going, I can't do this anymore. Can you help me figure out what do I do? How do I do religious exemption? How do I do this? I'm going to work somewhere else. And so the tide is changing. It's just much slower than we had hoped for.
Is there anything else you would like to say to either the people making the vaccines, the people administering the vaccines, or the people receiving the vaccines?
My biggest thing is that Western medicine and Big Pharma, the biggest thing they have done is taken the mother's intuition and squandered it and smashed it. Every single mother out there, and you saw that in that video, when they went to give those shots, their soul screamed, no, 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 no. All of you guys are feeling that. And it's an attack from everywhere. You're seeing it on TV that breastfeeding isn't really that necessary and you don't need to stay home, and it doesn't matter if you're at home with your kids, and it doesn't matter what you feed. All of that is not true. We all have to stand up and go, I'm taking my kids back. And I'm the mother, and I'm having a gut reaction to this, and I'm going to stand up to it. You can always pause. You can always go, I feel so uncomfortable about this, and you need to listen to it. And to me, we have to give the mothers their voice back. We have to give them their strength back. We have to support them to follow what their instincts and their guttural reactions are, and support the mothers in that. And honestly, I think we're the moms, we're going to be the ones that turn this, and we have to all support each other in following that. Deep down we know something is not right.
So the people, whether you're a practitioner or just a mummy, we're not just a mummy, peeps, did not mean to say that.
Just so you know, I've been a stay-at-home mom for 21 months now. Hardest job I've ever had, and the pay sucks.
Yeah, right.
Like, it was easier for me to work and have kids than just stay at home.
Whatever we are, we join together, and we're gonna crush this next year as a community. Thank you so much.
You're welcome.
Really, you're getting a lot of love here. How are you doing over there on We Are Vax?
It is all love. It is awesome.
Yeah, there really lots of love. And
a lot of capital letters. A lot of capital letters.
A lot of hearts going up here. So thank you so
You're
much,
welcome.
and we'll stay in touch. And you live here in Texas? Nice. See? Texas!
Yep.
Okay, guys, thank you. I know it's late for everybody, but thank you so much. And thank you for waiting to do this as well.
Yes,
Okay, we'll be back in a minute. We've got more.
Dr. Suzanne Humphries is a highly educated specialist in internal medicine and nephrology. She worked as a kidney specialist when she started questioning the safety of vaccines. She saw cases of kidney failure shortly after patients had been vaccinated during the flu season. After a lot of research, she wrote a book together with Roman Bystrianic called Dissolving Illusions, Disease, Vaccines and the Forgotten History. We met her during a lecture tour in Scandinavia and started by letting her explain the method of vaccination.
Well, vaccination is an attempt to expose the body to a hopefully benign form of the disease so that the body can respond as if it were infected with the disease without getting sick, and then can hopefully have memory of that infection for the future if it is exposed to the actual natural infection. The problem is that vaccines do not come into the body by and large. the same way as the natural infection does. For instance, measles is inhaled, but the vaccine is injected. That means that it has an exposure to the nervous system much more quickly through injection than it would through the normal inhalation and processing of the lymphatic system. Also, the vaccines don't just contain little bits of the bacteria or the virus or an inactivated virus. It also contains other chemicals, which the natural disease would not have.
And do you think this idea of vaccination, do you think that this is working? Do you think that this is a good method of keeping a population healthy?
You have to define working first, okay? Some people consider working means that you've suppressed a disease in a population. Some vaccines do work by that definition, but no vaccines increase the health of a population because vaccines do not increase the health of a human. There's nothing in a vaccine that our bodies actually require. We don't require aluminium. We don't require mercury, polysorbate 80. We don't require formaldehyde. And those are some of the things that are commonly in vaccines. So there's no nutritive effect of a vaccine. So I don't believe that vaccines create health in a population. And I believe that there are always better ways to deal with diseases in a population than vaccinating anybody.
Now, the pro-vaccine people, they say that with the vaccine, a number of diseases just disappeared from populations. How do you react to that?
Well, I would have to address each vaccine that they claim this to be true for. And I have gone through and looked at the smallpox history. And what we find with smallpox is that, first of all, that there was a town in England called Leicester. And that was a town that was highly vaccinated. And they were still having epidemics of smallpox and death from smallpox. That town decided to stop vaccinating. They were warned that they were going to set a bonfire of disaster upon the earth because they stopped vaccinating. But what happened was that their disease rates declined, as did their death rates from smallpox decline. So that is an example that shows you that stopping vaccinating actually can improve the disease in the population. And that I looked at smallpox first because that's the disease that most people say was eradicated by vaccines. But only 5 to 10% of the Earth's population was ever vaccinated for smallpox. And it was done during a time when there was lots of sanitation occurring, which meant that there were fewer rodents and insects around that were able to carry the disease from person to person. It meant that people's immune systems were improved because of better nutrition and child labor laws. So there were lots of things occurring during this period when smallpox disappeared. However, now, back during the time of smallpox, there was chickenpox, monkeypox, goatpox, horsepox. There were all kinds of pox that looked identical, were very difficult to tell apart. We still have monkeypox on the planet. So many of these pox diseases that we all lump together because we didn't have genetic testing, we still have these diseases. If you look at a person, a victim of monkeypox, it looks just like smallpox. So the question is, did we really eradicate smallpox? And I have my doubts about that. Okay, so let's get back to tetanus, because we're often told that, once we gave this vaccine, we saw this enormous drop in death and cases, and we're shown this graph here. And it really does look like, the tetanus vaccine came in around here, and look, we have this ski slope coming down. But the problem is, and this is how you'll be shown by the public health authorities, all the vaccines' success. They don't show you the whole graph. Here's what happens when you look at the whole graph. We can see that it was already coming down, and then it came down further. But look at how much more dramatic it was in England and Wales. And we can see that the decline in incidence and mortality is here, and the vaccine came in here, and we actually see it come up a little bit after the vaccine came in. And this is the same thing in Canada. We see that the death rate from tetanus They only started reporting cases here, but we could see the death rate was just precipitously falling. And this is the year the vaccines came in. And again, we see for some strange reason an increase right there, but we can't say that we have tetanus vaccines to thank, because the trend was already seriously coming down.
Is there a danger vaccinating populations as we do today?
Well, that's a complicated question, and I would say that adequate research has not been done. What we would need to do would be to look at a vaccinated population versus a not vaccinated population, and not just for one vaccine. See, the pro-vaccine will say that we have these studies, we've done them, but it's only one vaccine, and they call it a vaccinated unvaccinated study, when just missing one vaccine would qualify you as unvaccinated by their definition. So we can't do a study where we purposefully take people at birth and vaccinate half of them and don't vaccinate the other half. That would never be agreed upon by authorities. But what we can do is look at populations that are already not vaccinated, that live in the same place and are virtually identical in as many ways as possible as those that are vaccinated. And if you have a large enough group, you can tell the difference between them as far as disease rates go. Now, are they safe? You know, even the Supreme Court of the United States ruled last year that vaccines are, there's an inherent lack of safety some of the time. And so, because we know that vaccine adverse events occur, we have a system in place to compensate some of the people that this occurs for. But we don't have a system in place to compensate everyone that this occurs for. In fact, it's the vast minority of claims actually ever get compensated for. So just given this little bit of information I've told you, you have to wonder, are vaccines safe? Can you say that they're safe?
What do you say?
I say nobody has proven to me that they're safe, that I have scientific reason to believe that the components that are in them and how they act upon the immune system and the potential for autoimmunity and cancers and neurologic diseases is there. And so I cannot say, guarantee that these vaccines are safe, not even one of them, let alone numerous vaccines in the childhood vaccination program given earlier and earlier and more. And what you might notice, if you've been in the middle of this problem yourself, is that the people who want to vaccinate are often very aggressive, and they don't want you to hear the other side. And that should make a light bulb in your head go off. Why don't they want me to hear the other side? Why don't they think I can actually listen to both and come up with my own decision? See, I will never tell you not to vaccinate, but they will always tell you to vaccinate for everything. That alone, I believe, should be a red flag to you, that I'm saying you listen to everything and then you choose. What you do is your responsibility. And that's not what the people who are supporting this aggressive vaccination campaigns, more and more vaccines all the time to little babies.
You told on the lecture, you spoke about methods that authorities use to make people go and vaccinate. Can you talk about that?
Well, yes, I can. The methods, I showed you the exact quote from the New York Times from a Center for Disease Control doctor who said, literally, that fear is used in order to stimulate the masses to take vaccines. This has been done for a long time, is that pictures of dying babies, pictures of children with warped limbs from polio, and all kinds of visual material is given out. There's usually a consent form that tells you to consent, but doesn't tell you the risks of the vaccine, doesn't tell you that there may be any other way to deal with the disease if it occurs. Influenza is a great example. And we know that with the influenza vaccine, that it is not a highly effective vaccine. And even the Cochrane Collaborative Database has said that the hype and the lack of science around that we see in public, in the media, and even in medical journals is not consistent with the science that we have. So there's not only fear, but there's lots of misinformation and suppression, or I should say withholding of information that is known by those of us who have practiced alternative medicine, because we know that nutrition, hand washing, vitamin C, vitamin D, selenium are all things that not only can help with viral infections, but can keep the immune system functioning properly. This is a PowerPoint presentation that comes from Mayo Clinic. This is a very prestigious institution in USA, and this is one of our leading vaccine promoters in USA. And he made a PowerPoint presentation to give to all doctors to help them talk to people who don't want to vaccinate. And I just took out a couple of slides to show you. It was a very long presentation, but he basically is coaching these doctors how to deal with you. They say, don't plan on giving you any printed information. Don't plan on emailing you any links to information. Does that seem a little strange? They're saying not to give you the information. They said, instead, read and remember. Well, that's not happening. I can guarantee you that. This, I think, is the worst, most egregious statement here, which is he's telling them to persuade you rather than inform you. Doctors also are not told the whole truth, and I think that's one of the big problems, is that doctors are not taught about the problems with vaccination that can occur, and some doctors have actually been burned themselves that way. I showed you a slide today with the name of a doctor whose daughter had a serious reaction to human papillomavirus vaccine, and he had no idea beforehand that this was a problem, that this was a potential problem. And I think that every parent has the right to know, even if it's a small percentage of people that this has happened in, they have a right to know about it. And I think the biggest problem I have is that parents aren't given equally weighted information. They're given highly biased information. So that's another technique that's used. I showed you the other slide from the Mayo Clinic, which said to persuade rather than to inform. I also think this is injustice to parents all over the world who are being persuaded rather than informed.
And when the authorities tell the people to vaccinate, they are very sure, they seem very sure that this is the right thing to do. But on the other hand, when listening to your lecture, reading your book, they are not, they haven't really studied the whole picture, the subject of vaccination.
Well, I don't know what the authorities have actually studied. The authorities and I don't really speak very much. I think that a lot of them actually believe what they're doing, and I think that a lot of doctors have their own fear. They don't want to see their patients develop these diseases, and they really believe that the vaccines will prevent them, and they believe that the vaccines are safe. So I think that a lot of it has to do with kind of a religious belief in vaccination that even the World Health Organization may have.
You have been a doctor for a long time, and you have you used to believe in vaccination, and you have even given people vaccination yourself. And after some circumstances, you done your research. How did you feel during the time that you did your research?
Well, I really just felt motivated more than anything, because I realized that I was miseducated, and I realized there was a huge problem going on around me in the hospital that my family members had been exposed to, that friends had, and that there was just so much misinformation to get through. And so mostly I just felt motivated to learn as much as I could, because I found that knowledge made my my new beliefs about the problems have more weight. And I think that if we want to make an argument for anything, we need to have as much knowledge as we can. So it's really been my priority to read and read and read and understand as much of the science and the medical literature as possible.
But how did you react? Did you feel like betrayed, or because you went from being totally convinced that vaccination is a very good thing to do, to a more skeptical point?
Well, I take responsibility for what I've done in my life. And so if somebody made me go to medical school and kept everything away from me, maybe I would feel betrayed. But I chose to go to medical school. And I chose to limit my reading material to the degree that I did. So I didn't feel betrayed. I'm more of somebody who, when I see a problem, I grab it by the horns and I deal with it. And so that's what I did when I started this. What I realized is that it wasn't just the only area in medicine that I had not learned the full spectrum of information. And it wasn't the only area of medicine where the people that were teaching me didn't even understand as much as they needed to understand to make the statements that they were making, that there are other areas, you know, even treating high blood pressure turned out not to be taught to me the way that I would want to do now that I have read more and understand more about the way the body really works. So if anything, once I understood the problems with vaccination, it had me looking more at other areas of medicine. And I think that's one of the fears that the medical system has, is that if doctors start to see the big crack in one area, that crack will spread to other areas, and they will start to doubt, the way I did, the integrity of the medical system and where the funding is coming into the medical system and how limited our view and our knowledge has been. And we are told that so many things are quackery, when in fact the things that the medical system calls quackery are what I now see helping the most. And so I think the term quackery really needs to be redefined, because in the time that I have become a quack, myself and my patients have become healthier than they ever were at the time when I was not a quack.
Now, you said yourself that even if you go abroad to different countries known for diseases and such, you wouldn't take any vaccine at all. Why?
Because I take really good care of my immune system and my body, and I believe that it's always a gamble, right? So you have to pick which side you're going to run with, and you have to believe in it and do it. Okay, so if you're going to believe in vaccines, then you need to believe in it and do it. I don't believe in vaccines. I don't even believe a little bit in vaccines. I believe that they could do more harm to me that I may never be able to make up for. And I know that I am capable, my immune system is capable of handling diseases, and that I can enhance my immune system, that I can give my immune system the nutrients that it needs, that I can avoid the circumstances and situations that would expose me to different diseases. So that is my approach, and insofar as taking the odds, to me, for me personally, the odds are in not vaccinating and having some wisdom about how these diseases occur, and doing what I can to A, not contract it, and B, be ready if I do contract it to deal with whatever happens.
Now, the vaccine are being sold in to third world countries, poor countries like Africa, as an aid by very powerful people like Bill Gates, for example. What do you think? What do you think about that?
Well, I read this week that it would only cost $30 billion to end world hunger. And as Roman and I showed in our book, was that nutrition was one of the biggest reasons for the problems in the susceptibility and the death rates for diseases. Other problems included lack of hygiene and inadequate water supplies, clean water supplies. So what I believe is that Bill Gates and the billionaires of the world could really get together, much the way that the wealthy did in the UK and USA. It was the wealthy that did most of these changes. Is that they could get together and they could not only end world hunger, but they could be planting sustainable gardens, and that they could be enhancing the water supply. Now, they do a little of that, but I think they could do enough of it that the third world could change as far as disease susceptibility to the degree that ours is, and that the vaccines would then become perceptibly not necessary. This is from a little magazine that is very highly read in America. It's very popular, called Reader's Digest. And Kathleen Sebelius is our Secretary of Health and Human Services, a very high-level position in government. And she said that there are groups out there, like me, who say that vaccines are responsible for problems. And they say that we have reached out to the media to try to get the media not to give me my view or equal weight because she says the science has already shown the safety and effectiveness of vaccination, so my voice should not be heard. I couldn't disagree with that more, because the more science I know, the more indignant and upset I get, because I know that the science shows major problems with the theory of vaccination and with the practice of vaccination.